I think the first thing to say is we talked about earlier in the Budapest criteria, we have symptoms and subjective findings, and we have signs and mainly objective findings. Patients or clients faking the subjective findings is reasonably doable. Every doctor you go and see, you say, yep, that really hurts. My hand really hurts. My foot really hurts. Yes, it's really sensitive. Oh, doctor, you're putting cotton wool on me. That's really, really painful. So you can see that if somebody was determined enough, they could actually do that. And that still is most of the subjective findings. But in the Budapest criteria, certainly with the hypersensitivity, it's some of the signs, some of the other signs that you see. So what we do get asked is it possible for someone to fake the objective findings? Well, actually it is. And patients and claimants, and it's not just in the medical legal sphere, but also patients themselves have done and will do all sorts of things. And usually it revolves around using constriction, and that may be tourniquets, ligatures, elastic bandages, and casts. Other ways of doing it, prolonged immobilization, prolonged dependent state. So basically hanging your arm down for, hours and hours and hours and hours. Patients undertaking self-harm, which may include blows to the limb, repeated skin irritation. And one of my favorites is the naked foot in February. So this is somebody that turns up to the clinic in the midst of the February winter, and they have one foot that's completely normal, which is in their shoe with a nice warm sock on, and they're walking around in it. And the other foot they've basically dragged along behind them, and it's cold and it's got color changes and it's looking mottled and horrific. And that's really an environmental issue. I actually found a lot of these ways by researching this for the talk and previously. But what I also did is I asked my colleagues. We have a network of about 100 consultants in pain medicine throughout the UK. And before I did the talk, when I was preparing for it, I actually asked them, has anyone seen patients that fake it? And the number of stories that came back were quite significant and very interesting. One of the main ways that my colleagues seem to have twigged has been where they've actually examined the limb a little bit higher up, and then they've actually found ligature or marks or signs of constriction. So interesting. To put a bit more science behind it, these are two papers that often get quoted. And the details are here. We can give you the more information if you wish, but one paper that's often quoted is experimental forearm immobilization. So basically they immobilized patients' arms and it was able to induce cold and mechanical hyperalgesia. So this was not in patients who were deliberately faking their symptoms. This was in patients under experimental conditions. So it is actually experimentally possible to alter cold and mechanical hyperalgesia. The other paper that's often quoted is the effect of short-term dependency. As we said, this is basically letting the arm just go limp and not moving it. This was for about 30 minutes and looking at changes in skin temperature and color of the hand. So again, there is actually, apart from the anecdotal cases of ligatures and self-harm and that sort of thing, there is actually some science behind people using some of these things to mimic the symptoms.